Hi everyone, I am Stephanie with 9 Health. We're talking about prevention during a pandemic all this month. Dr. Coley was on the morning show this morning on 9 News. You know, a lot's been going on, the COVID-19 pandemic, the George Floyd death, the protests surrounding that. So maybe you're not thinking as much about your own preventive health right now. So we're kind of just putting this out there as a reminder to also check in with yourself, check in on some chronic conditions, assess your risk. We have new online screening tools that you can get at 9healthcare.org. One of those is for diabetes, and that's our topic today. So we're going to address what diabetes is and how the screening kind of works now, and I'll post a link to it in the comments so you can kind of check that out and assess your own diabetes risk. First, I want to introduce my experts. I have 9 Health expert Dr. Paul Coley, a cardiologist, but also an expert in preventive medicine and internal medicine, and registered nurse and certified diabetes educator Barbara Johnson from the Arkansas Valley Regional Medical Center with their diabetes education program. And the screenings we have online at 9healthcare.org, we started those to provide some screenings and education for the rural Southeast Colorado. We've worked with the mayor down there and in the lower Arkansas Valley to provide some screenings to rural Colorado, but you can also go online and check it out for yourself. We're gonna kind of make those more widespread soon anyway. But first, let's just get into some of these questions. And if you have questions on diabetes or preventing chronic conditions or COVID-19 or anything, you can post those in the comments and I'll get those answered for you. First, Barbara, you do diabetes education. Can you explain what diabetes is and some of the differences between different types of diabetes?
Good morning. There are 2 primary kinds of diabetes that we see in the community, and type 1 is about 5% of the population. And there's not anything really that people can do to change whether or not they get diabetes type 1. It is genetics. It is kind of an autoimmune thing where the body attacks the beta cells in the pancreas that produce insulin. And then in type 2, it's more lifestyle things. And there are a lot of things that we can do to change the type 2 risks that we have. One of them we can't change is age. After you hit age 45, your risk goes up greatly. Your ethnic group can change your risk. Hispanic population, African-American population, Asian, American Indian, all have a greater risk than the Caucasian population for some reason. So if you are greater than 45 and you are of those ethnic groups that have greater risk, if you're not active, if you're overweight, those are all risk factors that we tell you should get checked for diabetes once a year. If you are found to be at risk with the risk test that 9 Health has on their online website, you should get checked once a year. If you're not really found to be at risk on the risk test, you should be checked every 3 years still after you're 45.
And I just want to add one thing, which is, well, just where the word diabetes mellitus comes from, just a little historical perspective. So diabetes actually comes from the Greek word diabetes, which means to siphon off or to take off. And mellitus actually comes from the Latin word for honey or sugar. So basically, excess honey or sugar is being siphoned out of your body because people who have diabetes often pee out excess sugar. So that's just a kind of a neat way to remember what the condition itself is, which is just an inability to really maintain your blood sugar levels where they should be, an excess blood sugar in your bloodstream that ends up coming out in your urine.
And then I also wanted to ask you as well, and you discussed this on the morning show this morning, but we can get into a little deeper, just COVID-19 and diabetes, what people need to know about it. And, you know, if we even talked about pre-diabetes, just assessing your risk right now and why that's important.
So, you know, COVID-19 and diabetes are really emerging as kind of 2 things that don't go well together. And we've seen this not just in one study, but in a number of studies. Now, we don't yet know whether diabetes increases your susceptibility to COVID-19 infection. We do know that diabetes in general can increase susceptibility to certain types of viral or bacterial infections, but we don't have enough data yet on COVID-19. But what we do know for a fact is that if you do get COVID-19 and you have diabetes, your risk of hospitalization, of complications, and of dying is significantly higher. In fact, of the 5,700 people that were hospitalized with moderate to severe COVID-19 infection, 1 out of every 3 of them was diabetic. Now, it's encouraging to also know that you can actually reduce your risk of complications, not just from COVID-19, but also from other conditions by actually improving the control of your diabetes. And I'm hoping we can talk a little bit more about that today as well. But also recognize that this is a spectrum of risk. So there's nothing magical that happens when you transition from pre-diabetes to diabetes. It's really a continuum or a spectrum. And even those people in the pre-diabetic spectrum probably have higher risk of having complications from COVID-19, and they definitely have higher risk of having complications from heart disease, from kidney disease, from eye disease, from a lot of the other complications for diabetes. So if you're lying anywhere along that pre-diabetic to diabetic spectrum, I think it's really important to recognize that and really work on ameliorating your risk so that you can bump yourself down to a lower risk category. And as we talked about this morning, the ways that you can know whether you have pre-diabetes is you actually have to go looking for it, because you're not just going to know without at least doing some sort of screenings or looking at blood work. And so the good place to start is 9healthfair.org, where they have a free screening that'll allow you to really enter your own information and understand what your personalized risk may be.
Yeah, I just posted a link to the screening. So if you want to assess your risk right now, you can go do that screening. It just takes a few minutes. You get a score, kind of gives you, it gives you a number, but it kind of helps you assess your risk for pre-diabetes, type 2 diabetes, and then you can make the lifestyle changes needed or make an appointment with your doctor to discuss that further. Barbara, we talked a little bit about this, but just reiterate how someone would know if they have diabetes. We talked a little bit about pre-diabetes. I think I saw a stat that 90% of people that are pre-diabetic don't even know that they have that or are on the verge to having type 2 diabetes. So what are some of the ways that people would know they have diabetes?
So with both types of diabetes, you can have frequent urination, as Dr. Coley stated. In diabetes, you're sending extra sugar out in your urine because your body's not able to use it, either because of a lack of insulin in type 1 or an insulin resistance, which is more common in type 2. So frequent urination, and then of course, because you're sending extra urine out, you're more thirsty, so you're going to be drinking more water. A lot of times I'll hear people say, I'm really tired, or I've lost weight, or my vision is blurry. So those are kind of the most common things that people will say. And those are symptoms that you would want to get checked.
And then if you're having those symptoms, and then if you end up having type 2 diabetes, what are some of the health complications, if you can add on to that you would have if you did end up getting diabetes?
If you say that again, what are the complications?
What are some of the health complications someone would experience if they have diabetes?
So diabetes in control doesn't have to have a lot of complications. It's the diabetes out of control that causes complications. And if you start up at the head, it's strokes, it's blindness, it's heart attacks, it's kidney failure, and it's amputations, just kind of working your way down the body. But again, diabetes in control doesn't have to be scary. I see a lot of people who take very good care of themselves and have excellent health with diabetes. So diabetes does cause inflammation in the body because of the high sugar levels, and it can cause a lot of damage because of the inflammation that's there. But diabetes in control, doesn't have to be deadly or scary, either one.
And then Dr. Coley, you wanted to talk about controlling diabetes. So what is diabetes in control? What does that look like? And during the pandemic right now, what are your recommendations to people as far as seeing their doctor, making sure their condition is in control?
So one of the things that Barbara said, which I really want to emphasize and drive home, is that blood sugar control is very closely linked to outcomes. So if you can get your blood sugars well controlled, your risk of complications, organ damage, infections, all of that substantially decreases. So that's one of the most important things when it comes to diabetic control. And there's of course many different ways to control your blood sugars, including medications that are oral as well as injectable, such as insulin. But the most important thing is to know what your blood sugars are. So I strongly advise people with diabetes to have a really good sense of what their sugar control is running, because the signs and symptoms that we talked about, excess thirst, urination, many of those don't really occur until the diabetes is really, really, really far advanced. And so early in diabetes, sometimes you can have no symptoms at all. So again, one of the ways that you're going to know is really by doing screenings and by doing blood work to check. So the best way to know what your blood sugar control is a blood test called the hemoglobin A1C that tells you about your sugar control over the past 3 months on average. Now that one is good because it's not as susceptible to noise. But I recognize, as I said this morning, that a lot of people may be afraid to leave their homes or go to the labs at this time. So you can also check your blood sugars at home using a simple glucometer, which is a finger stick tool, which a lot of diabetics should have. I encourage a lot of my diabetic patients to purchase a glucometer so that they have a sense of what their sugars are running. And the American Diabetes Association says a postprandial or after eating sugar of less than 180 in a diabetic is really what's considered reasonable. But really what I recommend is to keep a little diary of what your sugars are running and then go over that in a visit with your doctor And this can be a virtual visit if you don't want to go into the office, but it is important to regularly visit with your doctor to talk not just about your sugar control, but also about the rest of the healthcare maintenance that becomes important if you're a diabetic. So you need to have an eye exam every year to make sure there's no changes occurring in the eyes. You need to have a foot exam every year to make sure that you're not developing a neuropathy, which is another complication of diabetes, or having any other changes in the foot that could suggest early infection or anything like that. And of course, you need to have your blood sugars reviewed with your doctor to see if your medications need to be adjusted. Don't adjust medications on your own. I want to caution you against that because that's not a good idea. Even if your sugar's high, the best thing to do is pick up the phone and call your doctor. And then finally, I would say you need to make a plan, a lifestyle plan for exercise, nutrition, counting carbs, maybe meet with a dietitian virtually in order to control diabetes. So you really want to try to attack it from all angles: lifestyle, education, medication, and then also the screenings.
And one of the other online screenings we have on our website is for nutrition as well, and I can put that link, which might be helpful. Someone said on our Facebook, the cost for healthy food needs to be lower than for me to eat healthy, which I guess healthy food is more expensive sometimes, but there are ways to, have better nutrition and still, not spend a ton of money, hopefully. But Barbara, maybe you can add to some of the prevention measures or ways to reduce your risk. Again, you're part of the diabetes education program in the Lower Arkansas Valley Regional Medical Center. So what are some things you tell patients as far as prevention or reducing their risk or improving their condition?
So if you are at risk for diabetes and you make lifestyle changes, there's 3 particular lifestyle changes that you can make that don't involve any medication, and they can reduce your risk by as much as 58% of going on to diabetes if you are less than 60 years old. And if you're 60 plus, it can reduce your risk of going on to diabetes by 71%. That's a pretty big deal. Some medications out there don't even work that well. So the first thing is start to identify what are the carbs in your diet. And if you have someone that you can talk to about carbohydrates in your diet, whether it be a nutritionist or a diabetes educator or find a diabetes prevention program, it's a good place to start. I can tell you that I myself was pre-diabetic. Diabetes is diagnosed at an A1C of 6.5 and mine was as high as 6.4. So I do the same battle that a lot of the patients that I work with are dealing with on a day-to-day basis. And now because I've done the lifestyle changes, my A1C, excuse me, is not above 5.5, but I lost weight. So if you are overweight, lose 7%. So if you're 200 pounds, that's 14 pounds. Try to lose it over the next year. Don't go on a crash diet. You didn't gain it overnight. You didn't wake up at 200 after being 150. You gained it gradually. So don't try to lose it too fast. Learn how to count carbs and manage the carbs in your diet. We do need carbs. Sugars are the main source of energy in our diet. We still need them. We just need to control them. I thought I ate pretty healthy before I found out I was pre-diabetic. And then when I started counting carbs, I realized I was eating twice as many as I should. I guess some of that was from growing up in a Norwegian home, and sweets were at every table that we ever sat at, and in between too. And then regular exercise. We're kind of a push button society. We push button the remote to do the TV on and off, and we clap our hands to turn lights on and off. And we have a cell phone, so we don't have to get up and walk to the phone anymore. And we're supposed to be getting about 150 minutes a week. That's 30 minutes 5 days a week, or 20 minutes a day, give or take a few minutes. And it's not really that hard. If you're kind of a couch potato, you can get a half an hour real easy just getting up and walking during the commercials for an hour or so. Just moving around your home. It doesn't have to be join a fancy gym, cost a lot of money. It's just about being active and moving. So those are the 3 things. Try to eat with less carbs in your diet. And I'll guarantee you, if you're eating as many carbs as I was, you will lose weight just by reining in the carbs in your diet. Try to be more active, 150 minutes a week. And I'm sorry, I'm having a blank here. Lose weight.
Yeah, and lose weight.
Yeah.
No, that's all great advice and things that people can implement. Dr. Coley, we have these screenings online again that you can do for free. just assess your risk. Normally right now we'd be having our spring 9 health fairs, but with the pandemic, we don't have those health fairs. We're trying to provide some information, some education for you. So 9healthfair.org, you'll find those free screenings. Again, I posted the link to the diabetes screening in the comments if you're interested in just assessing your risk. We developed these for the Lower Arkansas Valley and Southeast Colorado to start with, but really anyone can go check their risk right now. Dr. Coley, can you just talk about the benefits of assessing your risk ahead of time and the importance of prevention? It's kind of hard, I think, even without everything that's going on, all the turmoil in society right now, to think about prevention. So it's hard to have it top of mind right now, but talk about the importance of that.
Yeah, I think it is very, very important. In fact, more important now, I would say, than ever before, because we've realized what can happen with good preventive measures. So imagine if we could turn back the clock and prevent the COVID-19 epidemic. Imagine if we could prevent coronavirus from getting out, or imagine if we had had a vaccine that could have prevented what happened. So you can see that a small change can actually lead to a big difference in the outcome, and that's really the power of prevention. So it's like a train on a track heading towards a destination, and you make a teeny tiny change today, and in a few years, a few months, decades, whatever have you, whatever timeline you want to look at, the train is going to be in a whole different destination. And if that's not compelling enough for you, then think about the cost. So, the burden of healthcare treatment in the United States is so high financially, especially now in the setting of the pandemic. But if you're able to prevent a lot of the chronic diseases that use up the greatest burden of healthcare costs, such as heart disease, cardiovascular disease, diabetes, hypertension, many of these chronic illnesses, you can actually save the healthcare system tremendous amount of dollars. So in my mind, prevention is the best way to do it. And it can give you a much better lifestyle too. And if those two reasons aren't enough, because if you prevent something today, you're going to have a better lifestyle tomorrow, be on fewer medications, have a better quality of life, be more active. So those are all the reasons to really think about your prevention all the time, but especially now during a pandemic. And with diabetes, the really nice thing is that your body is giving you a warning when you're pre-diabetic. It is screaming at you that you can actually change the trajectory of that train just a little bit today and prevent diabetes from coming on. So when you're pre-diabetic, essentially what's happening is your pancreas are working overtime to churn out that insulin. And it's your body saying, oh, I'm running faster and faster on the treadmill. Let's do something to slow things down. And if you make those changes that we just talked about, cutting carbs, losing weight, exercising, you can reverse that trajectory, get your body out of that stress mode, and, not ever end up needing diabetes medications or insulin or any of those types of things. So I think it's really some empowering. Prevention in a way is so empowering because it means you can really take control of your health and change your health outcomes.
It looks like we lost Barbara, but we're about to wrap up here, but she had some great tips, shared some great information. So if you didn't see her on here, go ahead and rewatch this when we're done here. But Dr. Coley, I wanted to just follow up with what you just said. For someone that does have diabetes, making any lifestyle changes, how does that help them? Can it reverse the diabetes they already have? Does it just improve kind of their current state of their chronic condition? Just talk about if it does help at all for them to make lifestyle changes if they already have it.
Yeah, it actually does, even for those groups, tremendously. And so, like I said, we track a metric called hemoglobin A1C, which tells us about sugar control. And all of these changes, putting in less carbs in your body, so your body has less sugar to process, losing weight so that you have less of that insulin resistance, and then exercising, which also actually improves the action of insulin. So it makes the insulin you do have work better. All of these things actually improve the sugar control. So even if you're diabetic and you adopt these changes, it can actually, sometimes it decreases the amount of medication that you need. So we as doctors will actually turn down the doses of medications if your hemoglobin A1C is, running great as it should. Of course, it decreases the risk of complications down the line, like I said before. So the tighter the control of the hemoglobin A1C, the lower the risk of complications. And I'll just say one thing. Barbara mentioned that in order to be diagnosed with diabetes, you have to have a hemoglobin A1C greater than 6.5. Pre-diabetes is 5.8 to 6.4. And then if you're a diabetic, we really target your hemoglobin A1C to be under 7. So we really want that under 7% in order to tell us that we have pretty good control of your sugar. Now, the lower it is, the better in general. But what you don't want to do is drive it down so low that you're having risk of complications from the medication. So if you can drive it down low with exercise, with lifestyle changes, with losing weight, that's a dream come true. And it's very possible, even if you were above 6.5 and in that diabetic range, that you could bring it down and not need medication at all.
Right. Yeah, I think this is all great information that we shared today. Hopefully, those that are watching got something out of it. A lot of people thought we were talking about just prevention of COVID-19, but we're really just talking about prevention of some of these chronic diseases, reducing your risk, even just managing them if you have them. And like Dr. Coley said, it's, at the beginning of the pandemic, we were saying, stay home, don't go anywhere, but now you can check in with your doctor and kind of get them to help you manage your condition that you may have or that you're at risk of getting. And to assess your risk, you can go to our website. I posted the link to it directly because you won't just find it on our website, but we have a diabetes risk assessment that we created for rural Southeast Colorado first, but really anyone can take that risk assessment right now and just see where you stand. It's free, takes a couple minutes. Again, I posted the link in the comments. Also, if you have any health question about the COVID-19 or any other, really anything that you want to ask, you can call our 9 Health Neighbors line, 303-698-4455, extension 2005. Leave a message and a 9 Health medical volunteer will call you back. You can talk to a real person about any of the health concerns or questions that you have right now. Again, without our spring fairs, we're really just trying to educate you and provide some resources so you can get the health information that you need. Dr. Coley, thank you so much for joining us. Barbara also joined us from the Lower Arkansas Valley Regional Medical Center. She's with the Diabetes Education Program, and she was great. Go ahead and rewatch it because she had some great information that she shared with us as well. But I'll let you go. Thanks so much for joining us.